Hi, I'm Debbie Barron, and I'm here to tell you about our Napa Care for the Caregiver program. I started practice over 30 years ago, and at that time, we were just starting to use simulators. And we were very focused on checklists and crisis management in the OR and how to manage patient problems in the OR. And we did a great job. I think everyone now uses simulators for everything. The problem is we forgot the last step, which was we figured out how to standardize patient care and how to manage things, but we forgot what happens when everything doesn't go right and how to care for the caregiver. And everyone says, why do you need a Care for the Caregivers program? They are the cases that stay with you. They are the case that years after people can remember in their brain the snapshot, what happened here, what happened there, and you're always haunted. If I'd intervened here, if I'd said something earlier, if I'd called for blood, if I'd called the code, if I did something. And the answer is for most of that is we don't get to redo life, but we do have to live with it. And anesthesia is very personal, where they hear our voice, they look at us as they're going to sleep, and it's very, very personal. So the Care for the Caregivers program is developed. It is now under the Napa Patient Safety Organization, which allows you to call a provider. You are talking to another anesthesia provider who understands your language and understands your thought process and can go over the case with you. So many times when these things happen, it's, will I ever trust myself again? Will my surgeons trust me? Will my other caregivers provide me? How am I going to learn to live with this? And then what about my job? Will I lose my job? Will I be litigated? I mean, there is a storm of emotions that go when something like this happens. But it is, people always say, well, it's, this is a professional relationship. It's incredibly personal, and we all know that. And I'm always amazed how people will say, I've been doing this 22 years, I've been doing this 5 months. Actually, not usually 5 months. But everybody has a case. And I always say we need to train for this, because this is more likely that you will have an adverse happening in your career than probably MH or codes or anything like that, or OR fires. So we train for all these incredibly rare events. And yet when we have an adverse clinical happening, we act like it's a if event. It's not probably an if event if you practice long enough. It's a when event.